Shalom, good afternoon, good evening. My name is Dr. Tova Goldfein. We are live, Live, on our Be Live streaming software, which thank God it works every week. And I'm in Israel. It is 2 p.m. here. Our guest is in Israel with me, and Rose will introduce her in a minute. I just want to say a few words about our broadcast. It is, I think, number 158. This is about 3 years. March was 3 years that Rose and I have been streaming every week, just about. Talk about something you can rely on and something you can know is going to happen. Monday, TMS Roundtable. We are broadcasting with amazing guests, doctors, therapists, wonderful people like Shelley, you'll meet in a minute, who are healed, who are on their healing and recovery journey. People that have healed with chronic pain, autoimmune symptoms, authors, directors like Michael Galinsky, like Jonathan Neer. Just, we're so blessed to meet amazing people in this community of mind-body healing, understanding the art and the science, and understanding that we have a doctor within, which I like to say, and how we have a relationship with that doctor within. So to be continued. Hi, Rose. Thank you for staying up late and joining us today.
It's my pleasure, Tova. Now, ladies and gentlemen, we have got Shelley Souza. Now, I met Shelley when I was in Israel with Tova, and we had a wonderful time together. And she told me her story. And I thought it's so wonderful and it's important to share because, you know, we bring you lots and lots of therapy people, lots of alternatives of how you can get better or what you need to do. But here we have Shelley, who listened to the audio after 30 years of back pain.
30?
Yeah. On and off.
I think I said 10. And wow, I didn't even realize that. Amazing.
Yeah. Yep. So 30 years, every time something came up for her that was hard to stomach or take or whatever you want to use those words, she went to back pain. She found the audio, not even the book.
Yeah, there's a free audio of Dr. Sarno's book on YouTube, but she found that. Yeah, go ahead.
Yep. And we've got her. Shelley, tell us your story. And Tova and I will, you know, bring in things about your story so that our audience can get a good idea. Now, anyone listening to us currently, please, please, please write in to Shelley and she can respond to how she felt as she was observing, because it didn't happen overnight, and because these cures, as you call it, act as though when people are listening, oh yes, I got over it straight away. But her observing capacity grew all the time. It grew and grew as she read the book. So hopefully I haven't stolen your thunder. Go ahead and share with those that are listening. You're just lovely story.
So I started having pains. I remember I was driving to work in Tel Aviv, and I would always put a pillow under one side of my buttock.
Yashavan.
On the road. And I remember that, and I must have been in my late 30s. But I didn't pay too much attention. I was very busy, kid, work, husband, house, all those things. But I did have this pains on and off because I remember trying to go to doctors everywhere. You know, if I was in America, I went to a chiropractor. If I was wherever I went to an osteopath. I went to shiatsu. I tried many different methods. And of course, I went to the doctor and had all kind of tests, EMG, and they said I had this and that. But as I got older, I think maybe I had more time to pay attention to it, or maybe it got worse. But I became more and more, my life started revolving around this. You know, I was doing things in the morning. I would do something in the evening. I would walk around. I thought it had to do with sitting, so I never wanted to sit down. And it just became more and more frustrating, really, that it didn't have any way to make it get better, because all the things I tried didn't work. I don't know how I came across Dr. Sarno's audiobook. I really can't remember if I just found it or what. But I was very lucky to find that audiobook. So it was on YouTube. It's free. It's about 3 hours long.
I think it's in his voice. Is it his
Yeah,
voice?
he's reading it, and he's so patient and calm.
Actually, can you
logical.
Google it?
I will
Put it up
Google
on the
it.
slide. Yeah.
Yes.
Yeah.
Good,
And just the things that he said. So first of all, there's a lot of things that I remember. It was a long time ago since I haven't had back pain. It was in like 6 years ago. I haven't really had that anymore. That's not to say my back never hurts. I mean, if I work in the garden, it might hurt for a couple of days, but it's not what I had before.
Yep.
So what I had, they called sciatica, I guess. And then it would jump to here, and then you couldn't lift your leg. And it was all different symptoms, and it was very annoying. I always was a very physical person, so I always kept moving and doing. I mean, I didn't go to bed and lay down or anything. I always kept going, which was also lucky, I think.
So it didn't. So when you had the pain, like it concerned you, but it didn't scare you to stop.
Well, I think I was more scared of stopping. So
more scared of stopping the movement.
Yeah, I didn't want to stop walking, and I didn't want to stop, working in the garden, and I didn't want to stop those things, dancing. And those were things that I loved, really the things that I most loved. So I didn't want to stop. So I would do it anyway.
I would call that your willpower to just keep going, that resilient feeling in you. Yes, I've got this back pain, but I'm just going to keep on the go. But anyway,
and
I love how you describe
when I would go to these different types of treatments. What I noticed actually was, like, the first time I would go, say, to the osteopath, wow, I would feel great, and it was gone, and I was so happy, and this is it. And then it would stop working. And I realized that happened every time I tried a different method. So when Sarno was saying, I remember in this thing, he says that the biggest thing is to realize that it's not from a physical cause, and that only 17% of people that hear his lectures, he gave lectures in New York, are able to let go of that idea that it's physical. And of those 17% of people, 90 something, I don't remember exactly, 90 something percent get cured. Okay. But very few, only 17% of the population is able to understand that it's not physical, to really get it. But for me, when he said it's not physical, I was actually relieved, because I was like, wow, no wonder none of these things ever work. And for me, that opened up, it made something like open up in me that enabled me to accept everything else he was saying. Because it never made sense to me that nothing worked. It didn't make sense somehow. I'm a physical person, and I'm very attached to my body, and I couldn't understand how nothing worked. So when he said that to me, it was a relief.
It was a light bulb moment, as they say.
Did you stop?
It made sense to me.
Did you stop and think, well, I must be repressing some feelings, and what feeling am I repressing? Because that's kind of what he says.
No.
That didn't happen for Shelley.
Guys, but I'm not into this feely stuff.
Yeah, but you see, this is what happened with Shelley. She pushed herself through.
Right, and there was compassion there, because she wasn't bullying. she was like, hey, I'm going through some stuff here and I'm going to figure this out. Like it was, but see, I'm trying to, because you taught me this, Rose, also, you know, if she bullied herself and said, well, you stupid thing, why are you in back pain? She was like, whoa, this makes sense. I think I'm going to.
I thought it was funny, actually. I was laughing because the things that he says, the minute you're open enough to realize that it's actually not from a physical pain, everything you'd been doing and thinking just seems kind of ridiculous. I was really.
Well, that's what Howard Stern said.
Yeah. And I could really relate to that. And I did what he told me to do, what Sarno said. I very carefully followed all of his steps. And I'm not a very emotional person. I'm not a person who thinks about the past or the future or dwells on any emotions. I'm a very kind of next person. Now I'm going to do this, and then I'm going to do this.
Pragmatic.
I'm going to do this. Huh?
You're pragmatic. You just.
I guess so. I guess so. So I did the things that he said, which was basically the way I understand it is that your brain has become wired to think that emotion is bad for you. And
dangerous.
Very dangerous. And so instead of allowing you to feel emotion, your brain sends you this lack of oxygen. That's what he calls it. But which transfers to us and becomes a pain. And it can become very serious, this lack of oxygen.
Yes.
So what he said to do is to every time you get the pain, to first of all say, this is not physical.
This is psychological.
Right. And that's the most important part to me, I think. Yeah. And then to get to an emotional feeling, to actually feel an emotion. It doesn't matter so much what emotion that is. It can be anything. Okay. And if you have a hard time feeling the emotion, he says to write things. And I mean, he has all different ways of helping you to actually feel the emotion.
Yeah.
And so when your brain, after about 2 weeks of doing this, your brain says, wow, this trick that I'm doing of distracting her from her emotion is not working. She is feeling an emotion. So the brain just stops doing that and stops sending you that pain.
So what emotion were you feeling? Because I mean, what emotion would you go and you feel?
Well, the easiest one for me was to just think about that, to feel the fear of having this pain for the rest of my life. I mean, that was just the easiest one for me to.
But it's a perfect one, isn't it? It's perfect.
Yeah, because that was really true. That was really the truth. And I mean, maybe sometimes I did other emotions. To tell you the truth, it was a while ago and I don't really remember. I think sometimes I wrote a journal, like journal things until you get to an emotion. And after about 2 weeks, really, it stopped. And occasionally I would still have it. At a trigger kind of thing, like if my mother, something very like primal, but not very serious. And it would quickly go away when I did this Sarno work.
So what do you recommend to people? Like, because look, I know you personally, and you've had enormous, adversity going on, things happening in your life, and you were able to embrace it and understand it. What would you say to somebody who's not so resilient,
well, first of all, I think that Sarno explains it a lot better than I do, and he explains it very, very logically and step by step. So this is in English. It's called The Healing Back Pain from Sarno, and I would definitely recommend that. And I don't know what else.
Well, Shelley, could I just say to our audience that although Sarno's book is about healing back pain, it's about healing any symptoms, whatever they are.
Right.
Inflammation, even autoimmune illnesses,
Everything.
all of those things are all part of the same complex.
I think when he started, he himself was a back doctor or
He was a rehab. He was a rehab doctor.
So that was his main practice. Yeah, but he later realized that this is everything.
Fibromyalgia and IBS
everything.
And migraines.
So I remember him saying that because the body heals itself, any pain that you have that's longer than, say, 2 months, more or less, and which is then called chronic pain, or when you have a pain that's always recurring in the same place and the same thing, then that is emotional. It's due to this emotional thing. It's not, cannot be physical. Yeah. And I think that that's true.
Yeah. Well, you know, if you think about it, even if you break your leg, that's physical. But depending on how you experience breaking your leg, it can be much more painful for one person than another, depending on your experience. Can't it? Yeah.
It's like the nail in the boot. It's going to be worse. Remember the nail in the boot?
Yeah.
And then the guy had a nail in his jaw. He didn't feel any pain. Because we all have, and maybe what you're learning from this birth trauma woman, you're translating the book, is that we all handle pain a certain way because of how we grew up and how we were treated and how we were sick or not sick, or what we saw in the home, or these adverse childhood experiences determine. There's been a study called Adverse Childhood Experiences. There's a big study all over America. A lot of the doctors know about it, that because of our experiences as a child, we may react or respond differently to illness or sickness because of the foundation of who we are, personality. And Sarno goes into that. So did you ever think about, Shelley, that, well, maybe because I grew up like this, maybe because I came to Israel, maybe because
No. I don't like, I'm really a very person who doesn't like to go into all these things.
Show's over.
Because the beauty of it for me, and why it worked probably, is because I didn't feel like you really had to go deeply into your emotions, and you know,
you had pain for 30 years.
Yeah, but I'm telling you that what I understand about it is that it was just something like a kind of brain trick.
It clicked.
No, it's something your brain does. It's a habit. It's like a habit that your brain has gotten into doing. It doesn't matter how long. It doesn't matter. It can be forever. It's just your brain decided that pain was dangerous. He decided to distract you from the your brain decides that emotion is dangerous, distracting you from the emotion with the pain. And in this work, this Sarno work, what you are doing is reversing this thing, and the brain stops doing it, and that's it. So I didn't have to really mush around there too much.
Yeah. Well, no, but Shelley, in a way, what you did was you saw the trick that the brain was doing.
Yes.
Well, that's what he's explaining.
But you trusted, and you trusted. Look, you heard Sarno's words, but then you trusted your body. And what happens is a lot of people who go through the medical model, they lose that trust. They almost want a diagnosis from the doctor. They want, even if they don't get better, they want a diagnosis. So
yeah. I mean, I remember that when they tell you, when you go to this EMG and they say it's this and this and this, and you're like, aha, I knew it. And then you think, well, what is so great about this now that I know what it is? What is going to be? That's not so great.
Like, what's the cause? Like, even someone who has arthritis, certain people get arthritis, certain people don't, regardless of age. How about young people that get arthritis? What's causing that inflammatory reaction in their body? And we meet people that heal from arthritis. So you're really pointing something very important about neuroplasticity. You were able to change the brain by understanding the brain, the science.
I don't know. I think I just did what he said. It seems to me very simple. And you should all try that. I really recommend that. Don't think about it too much. Don't make a big deal. Just do it.
Everybody needs a Shelley in their life. Lighten up. Knock it off. It's okay.
No, I was very frustrated. I was very upset. I mean, now it seems a long time ago, but I was like, wow, this is ridiculous. It cannot be that every day in my life I'm going to feel pain and suffer. That's like, doesn't fit me. I don't want that.
Yeah. Shelley, in a way, every time you went to a therapist and it worked immediately, you started thinking. So your process was actually happening for quite a while. And then Sarno's audio put it together, because every time you went to a different therapist or model and it worked. And of course, then you started asking yourself, why was it so fantastic yesterday and today I'm back to the old story?
Yeah.
So you started reflecting, because part of what happens is that people are looking outside, whereas your mind was always going on inside.
You are
So
a very
just-
deep person.
Yeah.
I'm sorry.
Well, I was very determined to get rid of this thing. I mean, I was very determined. I tried millions of things, and I'm telling you, I didn't sit down for like 7 years. All my friends thought I was insane. I stopped driving a car. Until this day, I don't drive a car. I wouldn't sit around with people. I was just constantly like moving and doing like 8s, and
Restlessness.
I was just like, I had to get rid of this thing. I was determined.
Wow.
Shelley, your story is so amazing.
Yeah,
and
and I know some people are going to hear this and feel bad. Why can't I do this? Why? And they're going to feel good themselves.
Okay, stop for a minute. What she has told us is that she started looking at the picture much earlier on and critiquing what was happening. Whereas when you go to the doctor and you expect the doctor to fix you, and it doesn't fix, it fixes over for 24 hours or 48 hours.
Exactly.
Then Shelley started reflecting on that. And that's her healing power, that reflection. But most people with chronic pain see the doctor or see the specialist or whatever as having the final say in their bodies. And you're the one that often says the body heals itself. It's the doctor within.
Right.
So that's what Shelley was doing.
Yes.
All that time. She was utilizing that doctor within.
Very
so then
smart.
when Sarno's book came, bang, she knew.
Right.
And she had voices inside of her head, like she had the self-talk, and it might have been negative. Well, maybe this is BS. Like, I don't know, but it makes sense. Like, she gave it an opportunity and then she worked it. Because many of our clients that are not getting better and really struggling, I mean, we have such empathy for people that are suffering, but they get it, they read it, they understand it, but they can't apply it. They get stuck, and then they're on this treadmill. So what's unbelievable about you, Shelley, is you're able to work it and trust it. Somehow you stayed on your journey.
Well, it just seemed to me that had to be right, because nothing else was, definitely the physical thing was not right. I'd been doing that for 30 years and it wasn't right. And I just didn't have anybody else that told me something else. But the minute that he told me something else, I was like, aha.
Yeah.
That makes sense.
Yeah. It's that change, looking at the same story from a different angle. Yeah. And it's difficult for people, but I'm thinking that Shelley didn't have, Shelley did it over 30 hours or over 2 weeks or whatever. But in actual fact, she was critiquing everything all along.
Yeah. And I was always trying to fix it. I was always trying to fix it constantly. I mean.
Yeah. Well, when you say trying to fix it, I think you're actually saying each time you tried to fix it, it didn't work.
Yeah, but I always had it in my head that this was possible. I mean, I didn't think that it was logical that I would be stuck with this forever. It didn't make sense to me. It didn't seem right. So I was always trying to do something, and I was sure, I just thought it has to be something, but I couldn't find it.
Yeah.
So there's the will. There's the will.
I didn't give up. I never gave up and said, this is the way it is and that's it. Never. I never did that.
That's right. Could I just mention, ladies and gentlemen, that when I was sitting on Shelley's balcony and she's telling us this story, she said, I'm not going to have this pain all my life, and I'm going to win over it. No, they're not your actual words, But what you did say is, I'm not going to have this pain anymore.
Yeah.
And she said it with such
I
conviction.
really
It
didn't
was
want it.
amazing. And that's why I said to Tova afterwards, we've got to bring her on, because she's just.
Do you know,
just,
Rose? I'm sorry, I didn't mean to interrupt.
You're right.
So, Dr. Schubiner says in one of his chapters of his book, Hidden from View, which he wrote with Dr. Alan Abbas, that we can not bully ourselves. We can talk to ourselves like that. Hey, I'm not going to deal with this. You're not going to hurt me. And he talks about specifically, it's a kind of relationship of like, okay, you can do this. I know you can do this.
It's a challenge.
Yes.
You challenge.
Yeah. And so it was compassion. It was like, you can do this. There's no you didn't negotiate with your brain. You told the brain what to do. Where people are negotiating with their brain. No, you're going to be sick for your life. No, people are having this, like with the devil. I call it, don't dance with the devil. You are the boss. You are in charge. And that's what you did. You made a commitment.
Actually, could I mention about that, Shelley being in charge? See, often what happens is people see their symptoms as them. And Shelley was using that observing capacity all the time to see what was going on. So that's one of those, when you're not glued up to your symptoms and you can see what's going on, you can separate it out and observe it then. But for people with often, when they've had symptoms like Shelley has had for many, many years, they see that that's them. People will say to you, oh, I'm a shy person. But in actual fact, they're not necessarily a shy person, but they've got this shy persona. But there's a real person underneath it. Or I'm a gregarious person, or I smile all the time. But that's not really them. That's not the core of them. And that's what Shelley was able to do all along, is observe it all, see it from the back door, so to speak. Yeah. And then when that audio came along, wow, she went for it. And that's what, it was just so lovely. Honestly, that afternoon, as we sat there and heard her story, it just was so powerful.
Well,
I'm not
I met
going
Shelley.
to stick with this anymore.
Shelley's changed my life. I mean, we met. I came up to this area in the north, and I showed the All the Rage movie in a local home, and Shelley found me. He said, oh, by the way, I had a Sarno healing. I was like, I want to meet you. And she's introduced me to some amazing people, some amazing things in my life here in Israel. But I think what's interesting about Shelley's story, and Shelley was on the Hebrew show, because we compared her to someone who didn't heal so quickly. And we talked about, Marav and I talked about the personality. So Shelley also accepted her personality. And Rose, you talk about this, and you teach me a lot about character change. Like, you have to accept your character. You have to accept who you are. And I think Shelley didn't fight herself. No. She didn't fight herself. Like, no. She accepted who she was. She knew who she was. She didn't have to go into any deep discovery where some of us have to go and find ourselves to heal. Like Joe Dispenza says, you have to lose yourself to find yourself. And it's kind of, some of us are doing that with our healing journey. But Shelley was just like, I'm going to listen to Dr. Sarno and follow his book. And I'm like,
yeah, but he says that he says that a lot of people get healed that way. But the main thing is really this thing of really accepting that it's not physical. That, he says, is the main point. And I think that that's very easy to get hung up on, because even when you just start to heal and maybe you're getting a little better, it's just somehow, it's very easy to slip back, and then all of a sudden something hurts you. And then you again in this, it's very hard to sort of let that go, because doctors have been telling us that,
Panic comes in.
Well, the doctors have been telling you, I mean, this is really our upbringing from when we're small, all this. And he talks about that right in the beginning of that audio book, how it's all a kind of, societal made, all these people that are suffering. It's kind of horrible.
The doctors.
It's horrible to think of it, but it seems to be true. I mean, it's kind of, you know.
Look, we grew up in a medical model, and we are all part of the medical model, and the medical model has a purpose for all of us. I mean, you know, here in the social system in Israel, we have 2 minutes on the door with the doctor. It's not like we have an hour, but you know, for some of us it works, and others it creates a very negative relationship with the medical system, with the health system, and I think people are not taking responsibility, and that's what Rose and I are. You know, our flag is don't blame, take responsibility, self-reflect.
I think the first line, or one of the first lines in the thing is like, you know, everyone who has these things, they always start with some kind of, you know, 20 years ago, I fell off a ladder and this happened to me. You know, everyone has this pain and this thing somehow combined in their brain with some physical thing. That is why I think it's very hard to let go of it, because everyone's got it enmeshed with something that once happened, right? Don't most people have it somehow enmeshed?
Most people, yeah.
So that somehow reinforces the thing. So when they tell you, but it's not physical, you're like, but my back went and this happened and that happened, and so it's very hard to let go of that.
Yeah. Same with headaches. Same with fibromyalgia. Yes. There. See, Joy agrees.
and again, thanks, a lot of times with Rose and mine's work, you don't have to know the big trauma. Sometimes it's just a combination of things and how we perceive our world and how we grew up. It could be something just happened at work a couple of weeks ago that brought like why it happened, because it has to do with something that happened as a child. You know, Rose and I showed this video of Dr. Ed Tronick showing the insecurity of a baby because the mother turns away and the baby starts freaking out just because the mother turned away. You know,
same thing, Monica. Put up Monica's thing here. Same thing, Monica. It's always something that's going on for you.
The symptom is not really the place to focus on. The symptoms don't mean that the solution is different.
Yeah. Exactly. So if you, Monica, if you actually, Tova, if you put up that link to YouTube, and Monica translates headaches, migraines, to back pain, it's the same thing.
And because
it's smoke. If you see it as the smoke, that all of these things, you know, if you're burning rubber, the smoke's going to be black. If you're burning timber, the smoke's going to be lighter brown, gray. Yeah?
It doesn't matter. The fact is there's a fire causing, and what's going on with the fire? So, Monica, we want to support you in getting to the cause. It's not, we're not going to say anything different to you, to headaches or fibromyalgia. I don't say anything different to an arthritic patient, to an autoimmune. It's the body has attacked you, and we want to know why that interaction happened, why that imbalance happened, why your brain is perceiving a threat, and and how we can help you bring safety. Shelley was able to bring safety to her body, and that's how she healed.
Well, there you are, Monica. Go with the doctor. With the doctor, if that's what the doctor says.
The neurologist is doing his job.
Shelley didn't do that. But I have just read research just today or yesterday that says only 17% of patients who go to specialists have got a physical problem, and the specialists don't know how to deal with it. So they don't come back with a definite diagnosis because they're not able to give a definite diagnosis. So only 17% out of 100% can they actually do something for.
And I think Sarno also said he felt like he wasn't really able to help patients, and he didn't really know how to help them, even though he was a professional. And then I think just from lack of what to do, he started asking them, like, is anything going on in your life? What are your stresses? And then he somehow figured this all out.
Yeah. Exactly. Well, next week we've got another doctor on and actually it was Paul, wasn't it, that told us about the specialists and how few, how few specialists can actually deal with an issue
He was
that's
an
actually...
emergency room doctor, and he got no training in pain. He got no training in pain. So the medical doctors, the migraine, again, migraines are not normal, Monica. They're not to be, it's not something you have to accept. It's some imbalance in your system related to the blood and oxygen going to your head, relating to something. And so for you to see that healing can happen, and that the neurologist, it's not, how can I say this? Rose, help me here. To accept that he knows that what's going on in your body, that he's going to tell you that's incurable. That's, first of all, it's a thought. It's not fact. It's not science. You're not a number, a file. You're a human being with a migraine. We have had a number of people that have healed any migraines, and not saying that there's something wrong with you, but it's your journey. It's your recovery process. There's some reaction your body's having. Like Rose would say, who do you want to strengthen? What do you say about a migraine, Rose, from ISTDP work about a migraine? Who do you want to hit in the head? Who do you want to, we try to lighten it.
Don't give away my clues.
Yeah,
I'll give her a clue. What do you want?
It's very upsetting that you have migraines. Are a terrible thing. And I've worked with people who understand let me ask you this.
Okay, Tova, this is from an ISTDP perspective, Monica. When you believe that the doctor is right, you've got no hope.
Right.
But when you believe, like Shelley, that the doctor can give me some ideas, but they're not really sure about what they're saying, then you've got hope. And hope is an important, very important thing.
It's chemical.
Because chronic migraines are terrible because you become incapacitated. You've got to lie in bed in a darkened room.
And you're afraid all the time it's going to happen again.
Yes. And as soon as something stressful comes up, migraine comes. So when we actually see that, yes, it's good to go to the doctor so that you know that you haven't got a tumor.
Right.
But when you don't have a tumor, you know that it's somatic. Right. But if the doctor, as Tova says, hasn't been trained in this, there you are. Fear of an attack is huge.
Chronic pain is not, there's nothing incurable about chronic pain and disease. Diseases heal, chronic pain heals. You can even have a disease. I met a woman today who had MS, and she's living a life and hiking. She has plaques on her body. She's just in a higher elevated emotional place to not buy into her numbing fingers and her occasional sleepy legs. So it is something you can learn. If you can learn to be sick, you can learn to be well. Dr. Schubiner, unlearn your pain, unlearn your anxiety. Dr. Schechter, think away your pain. I know it's not so simple. You're in a cycle of fear, but the fact that I've seen your name, Monica, a lot, so I know you're reading and chiming into this work. Stay with it. Understand this is a journey.
But just the fact that the doctor gives what you have a name is somehow making people feel better, but it doesn't really make any sense because they don't have a cure for whatever they're giving the name to anyway. Exactly. So what is the good of the name? And
exactly.
No, seriously. And the thing about the fear is that the fear is more likely to give you a migraine than anything.
Exactly.
Because even if you were just getting maybe just whatever, a little something, and then that fear is going to turn it into a migraine.
Schubiner himself says the fear is worse than the pain.
Yeah, the fear.
So look at it this way, Monica. Your body's experiencing a threat, a huge threat, and protects you with enormous tightness, like tightening up like a sieve, your brain, your neck, and your cervicals and your head, to have a migraine. And then the whole, or the eyes and whatever happens. I've never had one, but I know it's terrible. And then we have to learn to bring safety And that's a habit. This is where you can learn to have a language of safety, or to look at life through a lens of safety. Oh, there's my fear. Fear is just a thought. There's no threat.
Okay, Tova, fear is not just a thought. If you think about it, fear is that a catastrophe is going to happen.
Okay.
So the fear,
it's a thought. It's not real. We don't. You're in the future. You're in the future. Oh my God, the future. You're not understanding that my worry about the future is creating enormous cycle of fight and flight.
Yeah. If you're going to cross a 6-lane highway without traffic lights, you're going to be full of fear. Or if you're a baby and your mother leaves the cave, the saber-toothed tiger is going to come and take you. So they're the fears. But these fears that people feel are catastrophic, as though they are crossing a 6-lane highway and that headache is going to not stop. So as they begin to observe, and that's what Shelley's story fits in so well, because she was observing it for some time. And this is what, because of that independent thought that she's got, she was able to actually see that yes, she'd have to put the cushion under her. She couldn't sit down. So she had fear as well. Mm-hmm. And she had all these precautions. But what happened was, at the same time with the fear, she also was critiquing the fear.
And responding. She was responding. Maybe, yeah? What do you think?
Well, no, Shelley wasn't responding. What she did was, when she read the Sarno thing, there was an aha moment. And that's what was so powerful, this aha moment. And Monica, when that aha moment comes for you, the same thing will happen. It won't matter what these doctors will say or don't say, because they haven't been trained with this chronic pain thing. And I've got a friend who works in chronic pain, and what they do is they're checking all these drugs out for people instead of asking them what's going on in their lives.
Right.
And actually, if you look at Karen Neaton from ages ago, and she shows how in the recovery room in the hospital,
she's a nurse.
When the patient comes out of theatre with a massive amount of pain, all she says to them is, "What else is going on in your life?" And as soon as the patient's able to say that, the normal amount of post-operative pain happens. And she's got this lovely scenario of the doctor ordering a ketamine drip for a patient who had a marina. And when the doctor came out again, the anaesthetist came out again, and the doctor said to Karen, "Where's my patient?" And Karen said, "Oh, she's fine. She's up in the ward. She's okay." Yeah. But what else is going on?
I was thinking about this, like the example that I gave you guys in the restaurant with the caveman and everything. But I was thinking that I guess that this threat, when your emotion is life-threatening, is when you're a small child. For example, you are very angry at your mother, for example, but you cannot be angry at your mother because you need your mother to feed you and take care of you and whatever. So your brain is smart to repress that anger.
Exactly.
At that time.
Yes.
And this happens again and again and again throughout your life until it becomes a habit. Every time you feel now a little bit of anger, something that happened in the street, whatever, just any things that happen, millions of things happen the whole day that make you angry, or whatever emotion. So these things just become a cycle. It's a cycle in your brain, and you can break that cycle by doing the Sarno work. That's what I think.
That's the key.
Shelley, I think you should come out of retirement and help Tova and me.
You want to be my assistant?
No. I'm having a good time in retirement.
Shelley has got the most beautiful, beautiful garden. Honestly, it is so beautiful.
Thank you.
Yeah.
Somebody else.
Cheryl made a beautiful comment. Thank you, Cheryl, for always. Cheryl healed herself from tons of itis, from bursitis, from sinusitis, from colitis. She was a flight attendant And
Had to
she
give up work.
was helped
Yeah.
by Rose's work
Yeah.
and talks and meets us often on our show to inspire people. And she went through a difficult time. She went through many years of struggling and suffering. So
Condo, what's it called? Condo.
Chondrochondritis.
Chondritis, yes.
Thing. Forgot about that.
Which is pain in the ribs.
Yeah.
Right.
Yeah. Exactly. Like in the in the joint. Anyway, but so thankful that you took an hour out of your day, Shelley Souza.
You're welcome. Very happy to do so.
Yeah, thank you. And if anybody has any questions for you, sometimes they come into our Facebook. I'm going to ask to send them to your, I might pose it to you. But you have some very practical answers and some reality checks.
There you are. It's like a full-time heart attack. It is, isn't it? Yeah.
Wow.
So anything else you want to leave with the listeners? There was
Actually, can I interrupt for a moment?
I like when you interrupt me because I do it all the time. So yes, please interrupt me.
Monica, Cheryl, is water skiing now. She couldn't even get up on her skis before. But once she realized what was going on, just like Shelley, that aha moment came and she was able to put the pain aside. And we had Cheryl on one session, and we put up the photo of her on her water skis.
Yeah.
And, she loved doing water skiing. And then all of a sudden, she had to give everything up. She had to give up her job as a flight attendant. She had to give up everything just because she was holding on to some feelings that she didn't want to acknowledge.
And it wasn't
as
like
Shelley said,
sorry.
Yeah, as Shelley said, you learn to keep quiet about your anger. You learn to keep quiet about your love and your grief and your sadness. And your joy isn't worth it. No one listens to your joy. So you feel isolated.
Right. Yeah. And the most important thing is not to blame yourself, not to lose hope, like Rose said. I know it's difficult to drum up the hope and the belief when you feel so much like a victim of your body. And so we understand that. And sometimes that's the place we have to come from. We have to climb out of the abyss and know that there's light. Like, somebody was talking to me about that. We live pretty much, I don't think I can repeat it as well as she did about the darkness and the light. Most important is that I'm going to round up and say goodbye. Any more questions out there? We had some really wonderful people watching. I mean, some numbers of people watching. Sometimes it's hard in the afternoon in Israel. We're at 7 a.m. in America. So we really love streaming different times so we can have a live audience, but it's always the next day. Thanks to the producer who's on the internet 24/7.
Our IT expert.
Yeah, and who's shivering, is having hives because of getting it on YouTube and getting the right tags and all. So it'll be on YouTube tomorrow. I think 158 show, and we're just thrilled. So thrilled to have Shelley in my life as a friend, and now to hear her story. And then she got to meet Rose. It was like a dream that Rose was in Israel 2 weeks ago.
Great.
What was that about? Anyway, so wonderful to be with you ladies together. And thank God for the internet. Really, we're lucky to have technical things and that me and Rose are learning them. And we'll be back next Monday to be continued. And thank you for all your showing up there and questions, Monica, and for sharing and opening up. Shelley, I love you. Rose, I love you. Love you. Have a wonderful night. Shelley, have a wonderful day.
Thank you.
God bless.
Thank you. Bye.
Okay, wait a second. It's going to stop.